Singapore has approved the Pfizer-BioNTech vaccine for the coronavirus. The first batch will arrive this month. In a national broadcast, Prime Minister Lee Hsien Loong has said there will be enough vaccines for everyone by the third quarter of next year. Now, he says it will be free for all Singaporeans and long-term residents who will be encouraged to get vaccinated, although it won't be compulsory. Singapore is also set to move into its final stage, or Phase 3 of reopening 2 weeks from today.
This COVID-19 vaccine, developed by U.S. pharmaceutical giant Pfizer and German firm BioNTech, will arrive in Singapore by the end of December. And in the coming months, other vaccines will follow. In his address to the nation, Prime Minister Lee Hsien Loong says if all goes as planned, the country will have enough vaccines for everyone by the third quarter of next year. These will be free for all Singaporeans and long-term residents.
I have personal confidence in our experts. My cabinet colleagues and I, including the older ones, will be getting ourselves vaccinated early. This is to show you, especially seniors like me, that we believe the vaccines are safe. So I strongly encourage you to get vaccinated too when the vaccine is offered to you. Because when you get yourself vaccinated, you're not just protecting yourself, you're also doing your part to protect others, especially your loved ones. The more of us are vaccinated, the harder it will be for the virus to spread, and the safer we will all be as a society.
Mr. Lee shared Singapore's vaccination strategy, which is drawn up by a committee of doctors and experts set up by the Health Ministry. It's recommended that all adults be inoculated, though this will not be made compulsory. Priority will be given to those at greatest risk, such as healthcare workers, those on the front lines, as well as the elderly and vulnerable. As for the rest of the population, this will be done progressively. The plan is to cover all those who want the vaccination by the end of next year. Mr. Lee said the country has been working behind the scenes since early in the pandemic to secure access to vaccines. More than 1 billion Singapore dollars has been set aside to sign advance purchase agreements and make early down payments for the most promising vaccine candidates. They include Pfizer-BioNTech, Moderna, and Sinovac.
We also supported local efforts to develop a vaccine. This gave our own scientists and researchers the opportunity to do cutting-edge work. It was also insurance in case the global supply chain was disrupted. This way, we built up a diversified portfolio of options to ensure that Singapore would be near the front of the queue for vaccines and not last in line.
Mr. Lee said there's light at the end of the tunnel and encouraged the country to keep up its efforts and complete its shared mission of defeating COVID-19.
At the same time, Singapore will enter Phase 3, or the final stage of reopening, from December the 28th. Groups of up to 8 will be allowed for social gatherings. The country's daily number of COVID-19 cases has been brought under control. While Prime Minister Lee Hsien Loong praised the nation for its efforts, he's also cautioned that the battle is far from over.
Public spaces in Singapore, such as malls, places of worship, and attractions, can soon take in more people. In 2 weeks' time, the country will further ease COVID-19 restrictions. Under the final phase of Singapore's reopening, or Phase 3, groups of up to 8 people will be allowed, up from the current limit of 5. However, Prime Minister Lee Hsien Loong warned the country not to let its guard down.
Because the virus is most likely still circulating silently within our community. Each of us needs to play our part. By all means, make use of the higher limits and reconnect with friends and family. But please do not abandon your mindset of watchfulness and caution. This is absolutely not the time to relax and let our guard down, or to hold a big party imagining that the problem has disappeared.
Mr. Lee says the decision to go from phase 2 to 3 is a calibrated, careful move. Restrictions are relaxed in a controlled way to keep the COVID-19 situation stable. But Singapore cannot keep its borders closed indefinitely. With trade and travel being Singapore's lifeblood, Mr. Lee said its only option is to reopen borders safely.
As we do so, we will see more imported cases. And there'll be some risk of these imported cases spreading to the community. We've already had a few cases recently. An airport staff who likely came into contact with infected passengers. A marine worker who picked up the virus after boarding ships to do repair and resupply work. This is a calculated risk we have to accept.
Mr. Lee gave the reassurance that every precaution will be taken to prevent imported cases from triggering a new outbreak. He added that phase 3 may possibly last for a year or more.
Tan Se Hui joins us live with more from the COVID-19 Multi-Ministry Task Force briefing. Se Hui, what was the rationale given for the vaccination not being made mandatory?
Well, the authorities say they want to respect people's decisions and their choices, but they're encouraging everyone to take the vaccinations because they've assessed that the vaccines are effective and they're safe. In fact, they're going to roll out a public education campaign over the next weeks and months to educate the public that vaccines are safe and indeed effective. But they did admit that they acknowledge that they're still studying the long-term effects, the side effects of vaccines. That's why they still can't make it mandatory. And they still want people to be able to exercise their choice.
Singaporeans may have a variety of different medical conditions in their medical history that may require us to be a little bit more prudent or to specifically match certain types of vaccines to their condition to ensure that their safety is upheld. So on that basis, in addition to what Minister has said, we've chosen to respect the choice of Singaporeans and not to insist that every Singaporean get vaccinated at this time.
So the first priority will go to those at greatest risk and those who are vulnerable. We're looking at the elderly and we're looking at in terms of health and age. But they did say that there is no specific take-up rate for the vaccines. Now, as for the long-term work pass holders like migrant workers, they're going to make sure that they'll be able to access these vaccines and they're going to make it convenient for them to get the vaccines as well. But this is all dependent on the schedule of the vaccines as to when they will arrive to Singapore.
So, Hui, let's talk about post-vaccination allergic reactions then. How will that be managed?
So for sure, those with serious allergic reactions, they will not get the vaccination. And for those who get vaccinations, they will make sure that there will be a short follow-up to ensure that they don't have allergic reactions. And if they do have allergic reactions, they will not get a second dose of the vaccine. Now, those who are exempted from the vaccines, we're looking at pregnant women and those under the age of 16.
And so I'm sure many people will be curious to know if there will be any relaxation of rules after the vaccinations start to be administered to the population.
Most definitely, they're going to be cheering that social gatherings can go up to 8 people, up from just 5 right now. We're looking at religious organizations, 250 people for each session at religious organizations. And we're looking at shopping centers. It's going to be an increased capacity. And for those who are into the arts and culture, live indoor performances, up to 250 people, that will be allowed. But for outdoor live performances, they're still going to be piloting that for about 250 people. Now, as we look at the Trace Together token, that allows the government to be able to quickly do contact tracing. Now, the adoption program, the adoption rate is at 65% at the moment. And to be able to go on to phase 3 successfully, there should be an adoption rate of about 70%. And we're fast achieving that rate at the end of the year. So the authorities are saying that the implementation of Trace Together app can happen next year, early next year. But Mr. Wong, the co-chair of the MTF conference, he did say that this is not a ticket to freedom, so you can't just do anything you want. So let's hear what he has to say.
We really need to look at all the measures holistically: vaccination, testing, safe management measures, and make sure that we have a full suite of precautions and safeguards. We will need to assess, as Minister Gan said, the effectiveness of the vaccine, not just in protecting yourself, which we already know, but the extent to which the vaccine will help reduce transmission risk. We know it will, but we do need a better assessment of how far it will go in reducing transmission risk before we can then look at it holistically and see what sort of adjustments can be made in the other safe management measures.
As for migrant workers, they will be part of a pilot scheme to allow them to have access to the community for once every month. So that's part of a pilot. And to ensure that that works out successfully, they will be regularly tested for the virus before they are allowed back into the community.
All right, many thanks for getting us up to speed with all the phase 3 developments here in Singapore. Tan Soo Hui.